Millions of Americans have struggled with an opioid addiction, often being prescribed opioids when other forms of treatments could have possibly served better. Tonight, Grant Green has more on a health consulting firm looking to work with health providers in the state to open up these options and make it clear that opioids are not the only way to go. It's our 5:30 top story tonight. Hello, Grant.
Good evening, Brian. Goldfinch, an Iowa City-based health firm, spent the last 2 days meeting with representatives from Avera, Sanford, and several state associations such as South Dakota Dental and South Dakota Pharmacy Association. The firm is hoping to work with hospitals and in turn patients to initiate a very progressive way of relieving pain.
So at Goldfinch Health, we're really out to help make sure that people get better surgery experiences. It's going to be a very vulnerable time in an individual's life.
Co-founder John Greenwood says the firm provides online nurses and a kit of pain relief options to help patients during the pre- and post-surgery journey.
This is a scenario a lot of times people have never faced on their own, and there's things that can go right and it can be incredible, and there's things that can go wrong.
Goldfinch has a $1 billion pledge to remove more than 1 billion unnecessary pills from cabinets around the country. Greenwood says they are not trying to eliminate opioids altogether as pain relief options.
But this is about making sure that the providers understand and patients understand their options and their alternatives and how they can play a major role in treating pain better, and even down to the timing of it as well.
Emily's Hope co-founder Angela Kennecke says surgery is often unrecognized as a gateway to addiction.
Educating the patient is so important because so many families we talk with had no idea how addictive these opioid painkillers are.
Kennecke says alternative-based pain relief options are exciting, but responsibility needs to come from companies who have been a part of the addiction crisis.
There are alternatives to opioids, and I'd like to see even more exploration by the pharmaceutical companies themselves to produce effective pain relievers that are less or non-addictive. We haven't seen that happen yet.
Goldfinch is aiming to become an applicant for the state's Rural Health Transformation Grant, in which funds potentially worth up to $200 million a year will be used to improve the quality of rural health.
And Greenwood says, as someone who grew up in a small town in Iowa right across the border, he understands the struggle of getting health care in rural life, and that having a team available to communicate and address patient needs and also improving protocol for hospitals is critical. Brian?
Grant Green at 5:30. Grant, thank you.